Okay, as I was listening, I wrote some notes. Okay, if anyone can see them all up there. It's rather scribbled and rather a lot of them. So there was a few questions asked, and there was quite a lot of answers. And I think, though, it goes back to me where I was really struck by was there's a lot of variation across primary care and how we need to really address that. And one of your colleagues said, what about the good practices helping out the not so good practices and learning from each other? And that's actually fundamental to what CCG needs to do and help to encourage. There's lots of research that you can quote, but probably the most important one is something from King's Fund that says actually, clinically, if you want to drive better clinical services and clinical change, it's actually through clinicians talking to clinicians, doing something called peer review and learning from each other. So that is something that we're driving towards in terms of with our grassroots GPs, and we really like to echo that person's comment is something that we really do fundamentally agree with. The other thing that I was really struck with is that there's an element that we've talked a lot about receptionists. And part of me wanted to sort of stand back and defend them a bit, because actually, in a way, it's a bit of shooting the messenger, isn't it, if we're not careful. There's a lot of need out there, and there's a few clinicians, as we've described before, and they're trying to actually make sure that that clinician is seeing the right patient at the right time. So there's a real difference between that sort of like triage and assuming that you're medically knowledgeable when perhaps you're not, and actually streaming the patient to the right place at the right time and making that decision to help that person get to see the person that they need to do. So there's part of me that wanted to just say that in terms of our reception staff, that quite often they're doing a very difficult job under very difficult circumstances, and maybe having received quite a lot of hard conversations prior to your conversation that you're having with them. But that said, we do totally and utterly acknowledge that there's real variation across the system, and we really need to support services getting better. So there's a universal standard that people know what needs to be done and how it's done. So there is a lot of, as Wayne was saying, around our need to help train reception staff and support them, so they've got clear protocols that they're following, and also making sure that they're not stepping out of streaming the patient to the right place, signposting to the right place, and into some form of clinical triage. So we will go away, we will listen to, I'm hoping that someone has been doing better than me in terms of the scribbling, because I don't think even I can read my own writing. I've been working with doctors too long. I'm hoping that Healthwatch will help us actually put down some of your comments more specifically, so that we can actually then sort of try and work out how we're going to start addressing them and going through them one by one.